We are coming to an end, and I make a short wrap-up with you. Cancer registries see their role more and more extended. I think that this evening was a perfect example of that. We are producing data about the current status. We show improving survival rates, which is hopeful. But we also draw the attention to the future and the growing numbers of patients to treat, but also to care for afterwards. And that number is growing. We need to invest in prevention on all sides, primary, secondary, and tertiary prevention to avoid the negative effects for the patients. We have to develop vision on short, but certainly also on middle and long term. We can do that driven by a cancer agenda, as was nicely set out, installed through the world and through the word collaboration. I think that the tripartite that was presented today with patients' organization, Dutch Cancer Society, and the Netherlands Comprehensive Cancer Center, that they will do a huge job. But not only within the Netherlands, but reaching out the hands outside the borders, and for example also with Belgium, maybe. Even move on with patient-anticipated outcome measures, which we have heard today. Let's listen to it and always take our patient with a central view and in a central position, because that matters. I want to thank you all, to all the speakers, the panelists, for having shared your thoughts with us and to bring forward the role of the cancer registries. I think that this evening was a perfect example also of visibility for cancer registries. And when hearing the numbers of people participating, I think that this is clear. We are so grateful to the speakers and also the stress that you face within a specific presentation here to speak to your public even when they are in space. Thank you very much to all the participants and maybe also some patients that have participated, because your presence means that we have some objectives in common and that we are moving on for further cancer control. And again, I repeat, and I heard from Siri also today, that repetition is sometimes not so bad, always taking the patient as a central guide in this work. Thank you for an inspiring evening to all of you. Oh yes, my question. I promised to answer you why the Belgian girl was here. I think because she knows that you are really the very best in the Dutch Cancer Center. I think I can hand over to you, Tess, for the final countdown. So thank you very much and good evening.
The final countdown, very short. You're here before you are the best chairperson we have ever had on an international symposium, with your sparkling eyes, your very subtle questions, and your inspiring conversation. Thank you, thank you, thank you very much. It asks for more cooperation.
Okay. With pleasure.